Well, today we have Karen Kingston, former Pfizer employee. She is a pharmaceutical and medical device business analyst with over 20 years experience in business development, marketing, sales, public speaking. She is an executive strategist, and her former clients include Allergan, Pfizer, Johnson & Johnson, and some of the big pharma giants that we are seeing at the moment. Now, Karen has, of course, put so much of her career at risk to bring forward some of the bombshell revelations that she has been bringing to the world about what is in these patents, what these vaccines are actually designed for, and what they are doing to people. Recently founding myfight.com, which we will talk about, where you can download a report with all of Karen's findings. Karen Kingston, thank you so much for joining us today.
Thanks for having me, Maria. I really appreciate it. And Happy New Year.
Happy New Year.
Cool.
In the event that anyone doesn't know about you, could you give us a brief career history? Tell us a little bit about how you got to this point, and the niggling at your conscience that made you speak out against what is really happening here.
Sure. Yeah, I've been in the industry for 25 years. I've always volunteered and worked in hospitals and AIDS clinics and things like that. And I actually worked for Pfizer right out of school in sales in New York City. And I quickly went over to the marketing agency side of the business. When I moved to California, I started my own firm. So I've worked for what they call Medicine Avenue on Madison Avenue. Worked on brands I'm sure you've heard of, like Viagra, Lipitor, brands like that. And then I had my own agency for a number of years. And basically, pharma companies, when we're living in a lawful society, whether it's a pharma company or a medical device company, what they can and cannot say is only based on two things: what they filed with the FDA, the data they submitted to the FDA for approval, and the law. And so when these started rolling out, these vaccines under emergency use authorization, the first thing I looked into was the guidelines for under emergency use authorization, which throw all of the safety guidelines out the door, as well as the efficacy guidelines out the door for bringing a product safely to market, especially something like a vaccine. And this is not a vaccine, it's what's called a viral gene-based therapy. And so I started looking into that. And then when they announced that they were going to be injecting children, God just put on my heart. It was like an anchor, and that scripture, for anyone, any man that knows me, if he causes one of these little ones to stumble, it'd be better that a millstone be tied around their neck and drowned to the deepest level of the sea. And that's what I felt, that they were coming after God's children, and God put on my heart to do for his children what I do for clients, which is I analyze scientific data, FDA submissions, intellectual property portfolios. And when I found the world patent for Moderna, which is the master patent for all mRNA, I didn't know a woman could cry as hard as I cried. I cried for 3 days, and it turned into wailing out to God, because it was clearly evil and demonic. They talk about things, not just the lipid nanoparticles, which are delivery devices, and also tracking devices for your vital signs and whatnot. So people were injected with a medical device, but they also talk about the use of luciferase and then the creation of triple helix DNA using these injections. So that is not of any of God's kingdoms. And it was, if you understood it, it was horrifying, just like we were talking about, reading Revelations. I know there's comfort, but when you understand the words, it's very upsetting. And I think if people understood what I understood, no one would be silent.
Horrifying is the word, and I guess this is why we need to keep speaking. And I know that you've been doing this non-stop, Karen, interviews every day. I mean, even right now, it's New Year's Eve for you, I believe, and you're still here with me, so we really appreciate it. So talk to us about what you found in some of these patents, please, because I mean, what I've seen you present is horrifying, like you said.
Yeah, and I think in the data too that you look at that was submitted to the FDA, the data doesn't hold any water. So and we can go through some of that as well. But any doctor that these that say that these are safe and effective, when the data shows they're not effective, it says missing information, vaccine effectiveness, it shows less than a 1% reduction in risk, or around a 1% reduction in risk for only 1 or 2 weeks after the vaccine. So any doctors that are claiming these are effective, I mean, they're not even worth their weight in salt, to be honest. I mean, they're lying. So it's quite alarming. But I think, you know, we were talking about the bigger picture of what's going on here. And so maybe we just jump right into the bigger picture, which is, as you were mentioning beforehand, this 70% of the world needing to be fully vaccinated. Tedros had just made that announcement by July of 2022. What are they rolling out? What is the bigger picture? And what we also talked about was the Organization for Economic Cooperation and Development, where all the world leaders were, including Antony Blinken, the Secretary of State from the United States, speak on behalf of the United States, and Biden, you know, committed to this timeline. But they also committed to rolling out an artificial intelligence workforce to become fully integrated across all areas of the United States and society. And I believe Australia would probably not be excluded from that. So I do want to share some US information with your viewers right now.
Please, and as you're bringing this up, I just want to talk to the audience about the fact that it is so important to watch the rest of the world. We know that Australia is following the US. Australia was the testing ground for the harsh measures, the harsh lockdowns, to really see how the rest of the world would respond. And that's why all eyes were on Australia. So it's so crucial to keep talking to people from all over the world, but particularly the main leaders of the Western world in terms of the UK, the US, and Australia, so that we can see the patterns that are emerging. Please, Karen, go on.
Yeah, so what I want to share with you, this will make sense in a second, is there's a division of the Department of Defense, that's what DoD stands for, called the Joint Artificial Intelligence Center, the JAIC. So this is a center, a legitimate center. There is a White House task force as well, and that's headed up by Dr. Lynn Parker. So these are new centers, these are new task forces at the White House, but the Joint Artificial Intelligence Center, it says right here, the goal is to use AI to solve large and complex problem sets that span multiple services and ensure services and components have real-time access to ever-improving libraries of data sets and tools. They go about accelerating the delivery and adoption of AI. It says here, establish a common foundation that enables decentralized execution and experimentation, evolving partnerships with industry, academia, allies, and partners, and cultivating a leading AI workforce. Now, this is not a military force. This is simply a leading AI workforce. So our Department of Defense is working at rolling out an AI workforce. And Dr. Lynn Parker spoke about this on October 4th of this year at the Organization for Economic Cooperation and Development. Blinken then followed on October 5th and confirmed some of what she said, which is full integration of AI by the end of Q1 2022. So how is this related to the vaccines? Well, we were surprised, and this was originally shared by Thomas Renz, the attorney. We were surprised to see that it was the Joint Artificial Intelligence that was tracking COVID-19 breakthrough cases. They have put together monthly, or I think it's actually weekly reports. So this report was presented on September 28th of this year. And what it shows is that there's breakthrough cases of those 65 and older. This is 5.7 million cohort of fully vaccinated seniors ages 65 and above. And you can see right here, 71% occurred in the fully vaccinated individuals. This total database was about 26 million. So they're the ones that we're tracking. So obviously the vaccine is not effective, right? If you have a 71% COVID-19, it goes on then to say that the hospitalizations occurred in 60% of those who are fully vaccinated. So again, these vaccines are absolutely not effective. But what was alarming, interesting, you should put up red flags, is why is the Joint Artificial Intelligence Center tracking this from the DoD? This should simply be CMS, this should be CDC data or FDA data. Yeah, exactly. So really interesting things. And I think this is part of the reason why. So this patent is by Gail Elric and Meir Fenster. They're out of Israel. They also have offices in the United States and United States of Emiratis. Sorry. And this was actually granted on August 31st of this year. This was the original submission from March 18th, but this has been fully granted in Israel, the US, and a global patent. And what this is it says methods and systems of prioritizing treatments, vaccination, testing, and or activities while protecting the privacy of individuals. And it goes on to explain how when you're injected with this vaccine, you are going to get an automatic ID generated, and that it can be tracked across multiple devices as well as to an external server. And it's best just to dive into the patent because these visuals are straight from this patent. And what this shows is that these are fully vaccinated people, and they have a network where they can share information across one another. And they say this is to determine risk. So the network across one another is this person maybe was near this person, and this person turns out to have a high score and high risk. So now this person can get notified that they were in this group where they maybe had high exposure. So that's what that is, while keeping allegedly the person's identification anonymous. So this is what this patent goes into. It's very alarming because, again, what it talks about is based on your behavior, your social behavior, who you're interacting with, what you're doing. This internal device is tracking all of your activities, and it's determining whether or not you need to quarantine or be vaccinated. So this is, again, from the patent. It's alarming. There's these groups of people, and they seem to be aware of the fact that this guy in the middle is a super spreader, and he doesn't seem too happy about that. Right. So this patent just goes into how they're going to track people. And then this is verbatim from the patent, section 0478. And Gail Elric uses this terminology. I'll just read it to you. Reference is now made to the following prophetic examples, which together with the above descriptions illustrate some embodiments of the invention in a non-limiting fashion. So he is prophesizing, he is saying, this is what we're going to track. And you've got John Doe, Jane Smith, and Mark Light. And you can see number of locations that they visit, total visits. And then, it goes on to the number of individuals they came in contact with that day. And every day they do calculations, and then they get a score. And it looks like here that John Doe should be eligible for quarantine or a potent vaccine. But gosh darn it, Jane Smith actually went to church a few times, so that bumped her score up.
So let me get this straight, just to clarify for the audience. This is in the patent. It is clearly telling us, there is no denying it, there are tracking devices in these vaccines that are enabling the government to track that people have gone to church.
Yeah, that's what the plan is. And I'm going to, this is the patent for all COVID-19 vaccines that are recognized and authorized by the World Health Organization. And that's also in this patent. So let me get to that in a second. But
Sure.
What you were saying, this confirms exactly what you're saying, is that these vaccines are used, it's a method and systems of prioritizing vaccination treatment in a pandemic situation while protecting the privacy of the individual. What's interesting is it has nothing to do with the virus, right? Because when they talk about COVID-19, it says here, I mean, this is such hooey. The virus is most contagious during the first 3 days after the onset of symptoms. Okay, fine. Although spread is possible before symptoms appear, fine. After they disappear, and from people who show very mild or never show symptoms at all. I mean, this is just, basically, if you are a human being, you are the disease. Right. That's what this is saying. You are the virus if you are human. It also says that the vaccine contain a microorganism or a virus in a weakened state, live or killed state. And so no, it doesn't. Okay. Vaccines are not allowed to contain just random microorganisms. They can only contain viruses in a weakened or killed state normally. That's, or a portion of a virus. So now they're saying we can put a microorganism in there. So this is the other alarming part, section 0350. It says in some embodiments, the term prophylactic treatment means preventative measure to fend off a disease, okay, COVID-19, or another unwanted consequence.
What's another unwanted consequence?
Rebellion, a revolution at this point, I think, is what it is. And then here, this is important, section 0352, as I mentioned, is vaccines are all compounds as disclosed in the website of the World Health Organization, and they give the URL. So to be very clear that this patent is specifically, it's not the Pfizer patent. People who were wrong when they said that. This patent is for any COVID-19 vaccine that the World Health Organization recognizes, and it links to the World Health Organization website in the patent in all versions. And you can find your vaccines in the pages of this patent. Whether, I don't know what you have in Australia specifically, but I found the BioNTech Pfizer, CanSino, we know that one's made out of China, and there's just a number, Sinovac, so they're all listed here. And then there's also another wave that's going to come out of DNA vaccines that are going to be used. So that's the next wave of technology for these patents.
What is a DNA vaccine?
So instead of using RNA, I'm not sure why there is a double helix, because the coronavirus is a single helix virus. So a DNA vaccine is not it's introducing new genetic material into humans is what it's doing, right? That's what it is. But so does the mRNA vaccines. To be quite honest, there's a press release that was put out in June of this year. You can Google BioNTech AGC, that's Alpha Gary, Cole, AGC Biologics plasmid DNA vaccine. And you'll see that AGC Biologics had put out a press release saying how excited they were to provide plasmid DNA for the Pfizer BioNTech vaccine. But plasmid DNA is used really for one reason, and it's for transfection. So it's to increase the introduction of new genetic materials into cells. So that's something you can look up as well.
I'll definitely look more into that, because I know that we've just had the announcement of Flurona, which is the most hilarious name to give a virus, but that is the hybrid of influenza and coronavirus. And I wonder whether this technology is going to be embedded into the next solution for this hybrid. I will look into it more and post it in my Telegram. Please go on, Karen.
Yeah, I'll send you the press release. Actually, I'll send you the whole presentation. I have a whole presentation on plasmid DNA and the press release, and it's worth posting. I'll need to pull it up for you. But again, this is also in the patent. So it talks about how there's going to be, this information is going to be shared with a third party. And it's a score. They talk about how there's going to be a dedicated mandatory app. Now, do you have an app in Australia now that you're using? Because
every state has its own app. They can't actually do a federal one, from what I understand, because there are some constitutional challenges. So they've given it to each state to manage, but they could be working on a federal one in future. We're not sure.
Yeah, I found one, I thought it was in Queensland, called G2G, which stands for Got to Go. I think it's in this presentation. But, the point is, based on your activity, you'll also have an app on your phone, and then you'll get communications to enhance your awareness to the behavior rules during the pandemic. And by the way, they plan on never ending this pandemic, we know that. To come and be vaccinated and to avoid certain locations which are at high risk of contagion. So, here's the thing, if you have a high score, why would you go in? So this explains, like, why would you go in to be vaccinated? So they also can monitor whether or not you're wearing a mask, washing your hands. So it's more than just who you're interacting with. They explain that you have basically a Bluetooth signal inside of you that can track all of this. And then you're given a score. And it goes on here where it says, for example, individuals that receive and are identified as a high super spreader score by the system would be vaccinated with more potent vaccines. Wow. So again, if I had a high score, why would I go in to get a potent vaccine? But I didn't, this is an abbreviated version. They actually have a section on coupon codes. So you could, if you're a doctor or you're a police officer, and let's say when you're not working and fulfilling your duty, you get a high risk score. But if they know that you are needed to execute this plan and to ensure people are obedient and enslaved into this plan, and some people will be executed by it. So if you're needed, you can get a coupon so that you won't be put at risk for a potent vaccine. So that's what this goes goes into. And then, just more evidence. You're like, well, what evidence do you have that this has a tracking device? Well, this is the master patent. You can find it on the Moderna
Karen,
website.
sorry, if I can just pause you here for a moment. Could you just go back to the previous slide? This to me seems like a continuous, constant cycle of getting vaccinated. You get a notification on your phone, go get vaccinated. There's no limit to this. There's no limit.
There's no limit. Death is not the limit either. So, I mean, there's more and more data that's been done in the United States where, we're showing that for, every 100 people, and especially children, every 200 children that die, I'm throwing numbers out there. I'm not, so don't cite me on this.
Sure.
Whatever. Every 117 children that will die from the vaccine, only one would be saved from coronavirus. So this is not about health, so there is no limit. Death is it's not even, I wouldn't even say it's an unwanted consequence. Death is part of the plan, right? That some people will be executed through the vaccination platform. Other people will be enslaved. Other people will be permanently disabled. So that's the plan. It's an execution, enslavement, and disablement, disabling humans through this platform, this technology platform. Yeah. So the end is when there's a collapse. I mean, it's a collapse of humanity. That's what the end is, I guess.
But even with the implementation of the Great Reset, which we are accelerating towards the economic collapse and everything that they have planned, even with the implementation of the Great Reset, we could still be looking at ongoing, never-ending vaccines, little notifications on your phone to keep getting these toxic ingredients into our bodies and making us less and less human as time goes on.
Exactly, that's the plan, and I think it's tough for people to understand that we are in a war. It is a global war. This is why all these countries have worked in lockstep. In the United States, we've never taken the lead of what's been done in other countries. I mean, we don't. Why are we following why is China, basically giving most of the orders? Like, since when do we lock our people into homes? Since when do we throw people into re-education camps? Since when do we make all of our citizens wear masks? These are common practices in communist China. Since when has this been common practice in democracy? It's not for safety. It's not for health. We are in a war, and we're at the point. I'm in a battleground here in San Diego where we have to be as dedicated and passionate about saving our lives as they are about killing us. And that's where we need to get to. People need to start organizing and understanding the truth.
And for anyone who, because a lot of people say that this is fear mongering, the truth is scary. The truth about what's really going on is scary. These documents prove to you what is really happening here, what is really behind all of this, the incoming Great Reset, the changing of what it means to be human. We heard Klaus Schwab talking about this back in 2016, talking about the ethical dilemma of changing what it means to be human. Well, we're seeing it right in front of our very eyes right now. Karen, please do continue your slideshow.
Yeah. So this, you could go to the Moderna website. I could send you the link, Maria. So this is the master patent on the Moderna website that was granted by the U.S. Patent Office. And what's important is that it does speak directly. Oh, yeah, I think this is it. Yeah, it talks about the lipid nanoparticles. So particle size between 80 nanometers and 160 nanometers contain the modified mRNA. So that is the virus encoding the spike protein. And so it just explains exactly what's in here, which is the ionic lipid, which has a positive ionic charge, a neutral lipid, a cholesterol, and a polyethylene glycol lipid, which is derived from petroleum. So it just explains, this is, you can be confident this is exactly what the patent is, and it encapsulates the mRNA. So mRNA is very unstable. So whether it's mRNA or it's from zoonic, if it's from animals and it's RNA, sunlight kills it, 80-degree weather kills it. Just the enzymes in your saliva kill it, the enzymes in your blood kill it. It's very difficult, if not nearly impossible, unless you're extremely immunocompromised, for it to ever even hijack your white blood cells and infect you, right? It actually is it's very, very unstable. So they had to take even the bioweapon, even the synthetic mRNA, and they had to make a little biosphere for it to live in, and that's what they had done. And the biosphere it's cholesterol, it's an ionic lipid that allows for penetration into the cells, and it's a polyethylene pegylated lipid in there as well. So, and a neutral lipid, which is the phospholipid, which also helps adhere, penetrate the cells.
Right.
So in this patent, if you go on to section 201, what they talk about is that the lipid nanoparticle may form a gel when injected into the subject, right? It may have controlled release system, it may have sustained release, et cetera, et cetera. And if you go on to like, it says it may be a gel like a hydrogel. And I think I have that highlighted on the next slide. Oh, I don't, hold on. Where is it? I'm sorry.
That's all right.
It should be in here. Sorry, it's blurry. Sustained release, composition over specific time, primary context. In here somewhere, it does mention the hydrogel, and we know hydrogel is made from graphene oxide or graphene hydroxide to conduct an electromagnetic field. So this
I'm
is
reading it there on the left-hand side of the screen, Karen. As a non-limited example, the polymer hydrogel or surgical sealant may be PLGA.
Is it in the first paragraph or a second?
It's in line 1, 2, 3, 4, 5, 6, 7. Line 7 of the first paragraph.
1, 2, 3, 4, 5. Oh, as a non-limited, the polymer hydrogel, or okay, surgical sealant, yeah, maybe PLGA, ethylene, yeah. Okay, so there you've got a hydrogel there, and it's mentioned throughout here. I know it's in there several times. So this also discusses this. So it is using the lipid nanoparticles to encapsulate the mRNA, but more importantly, to deliver these systems. And so within this patent, I found other patents. Specifically, this was very strange. It's a nanodiscs, right? And again, it says long circulating nanoparticles for sustained release of therapeutic agents. And I had found these a while ago, and I just didn't share them because just because something's in a patent doesn't mean that they've created it. But I don't know if you know who Dr. Zathra is, but
Yes.
yeah, so she saw these underneath the microscope, and I saw it on Stu Peters. And what these are used to, their delivery systems, these are used for docetaxel, which is for chemotherapy. I'm not saying that they're delivering chemotherapy, but they can deliver whatever they want. And these delivery devices can deliver gene therapies or products or drugs over a period of days, weeks, months, or even years. And that can be activated. Here is another one, which is the drug delivery system and use thereof of, these are nanospheres to deliver them. And again, this is similar to some of what the doctors had seen. And so in the nanospheres, they can actually put in, this was originally an anti-VEGF, but you can put in something that's actually, so anti-VEGF is a vascular endothelial growth factor, so anti-vascular endothelial growth factor. There's actually serum SRF, which is actually growth factor to enhance the growth of blood vessels and blood cells, so it can actually accelerate the growth of cancer tumors. So this is my point: is these are weapons. They are designed specifically for that purpose, and that's basically what I had gone over in this presentation. I'm sorry I don't have, sorry, you guys are seeing some of my, is this the one for Brandon? Is it this one? I think this is some of the stuff we had gone through. Oh, and then if you wanted to talk about, this is important too, about the gene editing and whatnot, and what the consequences, what the intentions are of these. So this slide here, I know you guys have seen this before. This is from October 22nd of 2020 of last year, where the FDA met and they listed working list of possible adverse event outcomes subject to change. Now in the industry, we thought that this list, I think many of us thought this list was put together based on old mRNA studies, right, that they had done before. But in fact, when you look at the contract research organization, so Pfizer uses what's called CROs, contract research organizations in the United States and throughout the globe to have done their trials. they were reporting into the FDA these consequences of the injections. So you have encephalomyelitis, so inflammation of your spinal cord and your brain, paralysis, Guillain-Barré syndrome. Of course, we have heart attack, acute myocardial infarction, myocarditis, pericarditis, swelling of the heart, autoimmune disease, which is very well known to be caused by synthetic mRNA protein-based therapies. They cause autoimmune diseases. Death was listed. Again, intravascular coagulation, so micro blood clotting, and the list goes on. Multisystem inflammatory syndrome in children, which we know the spike protein causes this in children. So why would you inject children with the SARS-CoV-2 virus to produce the spike protein and hijack their innate immune system? Because it's only going to result in autoimmune diseases, disabilities, injury, and death. So these are not adverse events. They're not side effects. They're not unexpected consequences. These are intended consequences. These are the effects of the injections.
Wow.
And there is no efficacy when you actually go through the study. Another slide from that presentation I showed you earlier on the Joint Artificial Intelligence Center. And what they just said here is breakthrough hospitalization increases with time, since mRNA vaccination increasing to 2.5 at 6 months post-vaccination. So a 250% increase at 6 months, your
And
risk
this
for
is
becoming
expected.
hospitalized.
They expect this.
This is the intended consequence, is to debilitate your immune system and to infect you. So you're infected with the bioweapon and the spike protein while your immune system's simultaneously being wiped out.
This is what conspiracy theorists have been saying for 2 years. This is what we've been saying for 2 years, and this is proof.
Yeah. Yeah, there's a document from June of this year where Pfizer discusses that the FDA discusses that Pfizer was asked to do additional follow-up when they unblinded the 2 groups. And what they found, the conclusion was that post-second dose, the risk for infection increases over time. Because what they found was the placebo group had a 5% infection rate, because they only had 4.8 months where they weren't injected, or there were 4.8 months that they were injected, where the treatment group had about 8 or 9 months, and they had a 7% infection rate. So they're like, yeah, as time goes on, your risk for becoming sick with a virus that we injected in you increases over time. So it's also in the FDA.
Every time these health officials, every time Fauci gets on and says we need more boosters, every time the World Health Organization says we need to vaccinate the world, we need more boosters, they are fully aware that this is the intended plan. There is no ignorance that can be claimed here, Karen, because many people say, well, they're just ignorant, they don't know, they're just doing whatever the science of the day says. But these people are fully aware that they have made these bioweapons with the purpose to break down the immune system, reduce the immune system and the ability to fight off more variants, create more variants in a never-ending cycle of vaccination, which is being tracked through a computer system that has now been injected into humans that can track their every move, including their religious moves, and cause them to go and get vaccine after vaccine after vaccine, turning them into no longer humans.
No longer humans.
And they know it.
Yeah, and part of the reason why I mentioned why I said I didn't know a woman could cry as hard as I cried, because you know, I had to fight for my mother to not be vaccinated, my 82-year-old mother. You know, because they said, you know, we believe that our days are numbered by God. God knows how long we're going to be on this earth. And long story short, my father ended up having a stroke as a complication of a surgical procedure, right? And what I said to my mother, I'm like, you know, she's like, well, maybe I should just get the vaccine. I'm like, no, Mom. I was like, you know, your days are numbered. We're very healthy people. And you know, this is not what God intended for us to become, to become paralyzed, to become paraplegic, to, at the age of maybe a 16-year-old boy, to have the heart of an 80-year-old man who's had multiple heart surgeries, like, so they cannot fulfill their life, their potential in life. And I think that's why I cried so hard, because parents who may be thinking that they're doing something to help their child they're actually disabling their child. and to be paralyzed and to not have the brain function that you used to have, to be able to have the cognitive skills. Um, it's sometimes it could be worse than an immediate death sentence, right? So that's why this is so horrific.
I want to ask you about the cognitive skills, Karen, because there are many people who are experiencing psychological effects as a result of these vaccines who are not reporting these, right? They're not actually aware. I know a few. With knowing what we do about what's in here, and we know now graphene oxide, cannot argue it, it's in there. This computing system, what is the capability now for humans to be controlled, granted they have these ingredients inside of them?
That's a great question. I can't answer it, but I really hit escape. I mean, let me hit stop share for a minute.
Sure.
We just recently, as you know, in the United States, prosecuted Professor Lieber from Harvard University. And he was one of the co-inventors of this nanotechnology, working with the Wuhan University of Technology. So equivalent to our MIT was the WUT. And what he specifically worked on was a delivery through a syringe of graphene oxide electromagnetic technology that could mimic brain structures, synapses and whatnot, so that it would be used as a weapon. So people could, soldiers could use their minds basically to execute plans, but also it would also be used to control soldiers as well. So that was what he was working on. So how far along it's been developed and is now in these vaccines when people are being injected, meaning, are they being injected and when the single-walled carbon nanotubules are deployed, through Tesla phoresis, is it then, overriding some of the key infrastructure in your brain? I don't know. We don't know.
Could you explain the last thing that you were just talking about the nanotubes?
Oh, yeah. So let me just, because I don't have the slides, but hold on. I can read to you the patent numbers.
Sure.
So if you look at what is this? There's a patent called single wall. It's SW single wall carbon nanotubes, SWCNTs. And there's a patent number US 2013/0251618A1. It was issued on September 26th. And what's interesting is the applicants, inventors, and assignees are all out of Beijing, China. This patent number you can find underneath the World Master Patent on Moderna's website. So that's how we know that it's in there. But what they explain is you can also look up Tesla phoresis from the Rice Institute. And if you look at this patent, they explain the single-walled carbon nanotubes, which are 1 atom thick. And they roll them up. So each nanotube is rolled up into a delivery, and it's just, nanometers in size or nanograms in size, and it's injected into you. But there is it appears to be a small copper coil. And so when activated, these nanotubes will then expand. So they can expand into like a receptor area that's up to 30 square centimeters, just flat. Or if you look at Tesla phoresis, it expands into like this whole wired operating system, and you see it kind of come out in its multiple wires, and you can see it's building an infrastructure. So that's what that's for. And the question is, how much can that actually control our central nervous system? I did work in people, I know this sounds crazy, but I did work also for Medtronic's neuromodulation. They were a client of mine for about 4 years, division. And they have a thing called leads, which are these electric leads, wires that they put up and down your spinal cord. And what they're able to do is they used to use it for chronic pain. So they would stop sending that signal to your brain that you were in pain. That's all it did. So they rechanged. They also used it for depression. They would just they would send a new signal to your brain to say that you're happy. And then they would send a signal, they cut the signal off to your brain to say that you are in pain. What's so evil about this is people, Elon Musk talks about, well, how great would it be if this was just kind of inside your head? and then you could feel like you're skiing in the Swiss Alps or scuba diving in Palau and Yap, and you would really think that you were there. And isn't that amazing? But just like you can have these fantasies that are amazing and think that they're there, you could also have horrific nightmares. So they can induce the most horrific kind of pain on you, and there's nothing you can do to stop it. So it's really, we need to fight and defend for our lives as passionately as they are to take and overtake them.
And what activates these nanotubes? Because we've seen this footage, we've seen sound, and these wires that you're describing, and people have been doubting it for some time, or people watch it and they believe it, but they don't understand it. We've seen, music creating these patterns where we see graphene oxide making what essentially looks like a central nervous system, a new one.
Mm-hmm.
Do we know yet what activates it?
It's an electronic pulse that activates it. So there's an electronic pulse that's going to activate it, but we don't know. I don't know what that pulse is. I don't know what frequency it's at and whatnot. So, but at the same time, there should be an electronic pulse that should be able to deactivate it as well.
Right.
It's something, and I don't. Again, this sounds so bleak, and I don't want it to sound bleak because there is hope, right? But the world can't be healed until it recognizes that they've been harmed, right? We were all told the greatest lie in the history of the world, right? That there was this virus and we needed to give up our freedoms in order to protect one another. And that was simply a lie, a horrific lie. And now we've trusted these people who lied to us and have nefarious and evil intentions. But it's time to wake up now and say enough is enough, and do not participate in this game anymore. And it's an evil game, and they're caught red-handed lying. I mean, there's no evidence that these are safe and effective. All the evidence is that they're deadly, harmful, and they cause permanent injuries. And now, we are seeing people, they're magnetic, and they're making their phones or giving off signals when they're near them. So I do believe there are treatments that can help stop the progress of the damage and reverse it in some people. So,
well, Dr. Carrie Madej speaks about this and speaks about sort of a detox from the ingredients, and I'll hopefully be speaking to her very soon. Karen, I want to talk. Look, what you're saying is right. It does sound very bleak. The reality is that what they're trying to achieve is bleak. It's not, there's nothing good about it. It is an evil plan to control all of mankind at levels that we've never seen before, apart from kill us off. It is a bioweapon. It is designed to destroy us. But yes, of course, we can put a stop to it. We wouldn't be fighting if we couldn't. So I want to talk a little bit about my fight, Karen, if you just tell everyone what that's for, the information that they can find on there. It is http mifight.com. Talk to us a bit about that.
Sure. It's excuse me. It's a website that I just started putting together. Clay Clark has been helping me, but the idea right now is just that you can go and download some of these presentations and documents regarding the injections and the publicly available information that you have. I am going to be putting up information for U.S. citizens regarding the legal violations that are happening in regards to. We have something, as you guys know, called the Constitution. And what's happening right now is there's a violation of our civil rights under U.S. Title Code sections 18, 241, and 242. And 242, this is interesting, and I don't know what law it applies to in Australia, but there's something called violation of civil rights under the color of law, and that's when any elected official, government official, or public authority pretends to have authority that they don't have and to be fulfilling duties that were never assigned to them. Right. And if it results in the injury or death of American citizens, then that can result in life imprisonment or execution. So that's some of what's going on right now is we have mayors, we have governors, we have a president who is trying to force a mandate across the country. In the United States, we are a republic. Every state is fairly autonomous as long as they're not violating the Constitution and Bill of Rights. So he had no authority to make a mandate across all 50 states. And so that's a violation of civil rights under the color of law, where he's pretending to have authority that he does not have.
Right.
So that's, I need to work on the website. Like I said, like you, I've just been going 24/7, but eventually you'll be able to go there and download also letters, like very well written legalistic letters that can walk through very clearly and fully referenced documents that show the harm that these vaccines cause to adults and children, with just irrefutable documents. It's the documents that are from the Pfizer company, the pharma companies themselves, or the FDA or the CDC. And even the world, I have been looking at the World Health Organization as well, because their documents for mass vaccination are quite alarming. I'm not sure if you saw, Maria, they put out a document for mass vaccination at the school level, saying that they can enter into treaties with countries. And if they enter into a treaty, a child attending school, by the act of them being at the school, the parent has given the authority for that child to be vaccinated.
Yes, and I think if not in the same document, another one, the child's consent doesn't even have to be a word anymore. It's like a murmur. Do you understand that you're about to get vaccinated? And they're talking about making that for children, if I'm not mistaken, 5 years or 6 years and above.
Yeah, it's 5 years. Yeah, exactly. I mean, whatever they're able to, it looks like they're using the FDA in the United States. So whatever they can push through the FDA to get emergency use authorization is what they're going to use across the globe. So keep in mind, right now it's 5 and above, but they are looking at 2 to 5 year olds right now. They're studying that. Fauci said they're not getting the robust immune response that they want. I think honestly, the children are probably dying. And then they're going to go as young as 6 months of age to inject them. So
yes, we've just had approval for Moderna here, 12 years and under, and it doesn't specify where it starts. So literally from birth.
It just says 12 and under?
12 and under, correct. So we were told back earlier this year that Canada and Australia would be the testing countries for Moderna for 6 months and up, but the approval actually says 12 years and under. It does not specify a starting age.
Yeah, I don't know if people know, in the studies too, they never actually, they state, at least in the FDA studies here in the United States, they say, due to epidemiological trends of the virus, they basically stated statistically and clinically impossible to prove that a vaccine would be more effective than a child's immune system against COVID, because they don't get the virus. They don't get infected with it. They would never be able to confirm enough cases to prove anything of clinical or statistical significance, even with all the lying and fudging that they did in the adults. So this is nothing more than to harm, disable, and kill children. I mean, I'm so sorry that, it's a battle. Like I said, we need to be as passionate about protecting our lives and our children's lives as they are about taking them at this point.
I certainly echo that, Karen. There is no time for rest when you are in war. And I just echo the words of Dr. Robert Malone in my interview with him, where he said, children will die, kids will die. It's going to happen. It's already started to happen. I think, if we haven't been motivated by protecting our neighbor thus far, and we've kind of just been watching our own back, and there's many people like that, we should at least be motivated by protecting children, because they are innocent in all of this. They cannot do and probably wouldn't comprehend the research that someone like Karen has done, but you do, you can, and it is your duty and my duty to protect these little ones. Karen, we thank you so much for your research, all of your time and your efforts, and definitely we'll speak to you again in the future.
Yeah, I'd love to come back, and we can do a specific episode on the children. Keep in mind too that if you take a look at the November 20th FDA document that Pfizer submitted, there's a section there where they discuss there was a group of 100 children aged 12 to 15 years of age, And it specifically says that the risk benefit ratio was not favorable. And the sponsor, Pfizer, the CEO, Albert Bourla, said, do not disclose this information to the public. So it says right there that it was harmful to the children ages 12 to 15. And there were 100 children that were studied. That data has never been disclosed. We don't know what happened to those children. So what happened to Maddie de Garay never needed to happen. They knew that they were harming, disabling, and killing children on November 20th of last year, and yet they still moved forward with that study. But what they ended up doing was they had close-ended electronic diaries. There was only about 18 side effects that you could check off for your child. So permanent disabilities, paralysis, and death wasn't an option, which is why Maddie de Garay is listed as a stomach ache, and she's paralyzed with a feeding tube.
These people are murderers. They are psychopaths. We can see throughout everything that you've presented, Karen, what the bigger plan is here. We must do everything that we can during this time to protect these children, and definitely we'll have you back very soon, Karen, for a segment on the children, so that we can educate parents around the world on what they need to do, what's in here, why they need to protect their children.
Yes, I think that's, yes. Again, we need to become passionate about protecting our children, as passionate as they are about harming them.
Karen Kingston, thank you so much for your time, and God bless you.
Thank you. God bless. Bye.